Welcome back to another Explainer. Today, we're unraveling a truly fascinating biological mystery. We're going to look at how a failing organ in your abdomen can literally hijack your brain. It's a condition called hepatic encephalopathy. Basically, it's a severe complication of liver decompensation, and get this, it happens in about 30 to 40% of people who have cirrhosis. So we're talking about a very real, very complex chain of events happening right inside the human body. So let's dive right in and investigate this bizarre connection between liver failure and some pretty severe neurological symptoms. We are talking about patients showing up with uncoordinated movements or completely reversed sleep cycles, sleeping all day and staying awake all night, and just profound cognitive decline. Which begs the question, how exactly does a scarred liver spark a full-blown brain crisis? Well, to figure that out, let's start with part one, the brain under siege, and track down this rogue neurotoxin. Okay, tracking this attack path, we can actually see how the toxin completely bypasses a cirrhotic liver. Usually, the bacteria in your colon break down dietary proteins, which releases ammonia into your GI tract. Now, normally, that ammonia heads straight to the liver, and a healthy liver just converts it into harmless urea. It's like your body's built-in filtration plant. But in a patient with a failing liver, or if the blood is bypassing the liver altogether through shunts, that ammonia just builds up. It enters the main bloodstream and dangerously crosses the blood-brain barrier. Once it's inside the brain, these cells called astrocytes try to play cleanup by converting the ammonia and glutamate into glutamine. But here's the catch. Glutamine acts as an osmolyte, basically acting like a sponge pulling water right into the cells. The astrocytes swell up, causing cerebral edema, which is just a medical term for dangerous brain swelling. As this swelling takes hold, patients start showing some very strange neuromuscular signs. The most famous one, it's called asterexis. If you ask a patient to just hold their arms out straight and bend their hands back, you'll see this distinct, involuntary, coarse flapping motion. It's not rhythmic, it's just this constant flapping. It is a massive red flag, a key physical sign that the brain's neurotransmission is being severely disrupted by all those toxins escaping the liver. Which brings us to the next phase, staging the cognitive decline. We're going from subtle clues all the way to a coma. Because this condition is a progressive spectrum, it's absolutely crucial for doctors to distinguish between covert and overt disease. Covert hepatic encephalopathy is kind of a silent danger. Patients might not even realize what's happening to them, but they experience these subtle cognitive deficits that severely impair their ability to do everyday things, like driving a car safely. In fact, doctors literally have to use specialized psychometric tests, like the number connection test, just to detect it. Then on the flip side, we have overt disease. This is where the symptoms are dramatically visible. We're talking noticeable asterexis, slurred speech, heavy confusion, and lethargy. You really can't miss it. Looking at the West Haven criteria here, we can really map out the stark escalation of this condition. This is basically the structured framework clinicians use to grade overt disease. Grade 1, it starts off with a trivial lack of awareness, maybe some sudden anxiety, or even unexplainable euphoria. But then, by grade 2, things escalate. We see lethargy, some minimal disorientation, and that flapping tremor we just talked about, asterexis. Grade 3 ramps up to severe somnolence and gross confusion. The patient is basically in a semi-stupor, though they are still responsive. And finally, grade 4. This is a life-threatening coma. So you can see why staging this accurately is absolutely vital. It dictates exactly how aggressively doctors need to respond. And respond they do. This brings us to the third part, the counterattack, or shutting down the toxin factory. The goal here isn't just supportive care or a temporary band-aid. It's about actively targeting the actual source of the ammonia factory, which is located deep down in the patient's gut. Now, doctors traditionally use two main weapons to shut this factory down. First up, we have lactulose. This is a non-absorbable sugar, and it's super clever. When your gut bacteria break down the lactulose, it creates an acidic environment that forces the ammonia to convert into ammonium. And why does that matter? Because ammonium can't easily cross back into the bloodstream. It's essentially trapped right there in the gut. Plus, lactulose acts as a laxative, literally flushing the trapped toxin right out of the body. Then we have our second weapon, rifaximin. Think of this as a highly targeted assassin. It's a specialized antibiotic that stays mostly in the gut, binding to bacterial DNA and completely killing off the specific colonies of bacteria that are producing all that ammonia in the first place. Which leads us perfectly into the final phase, the power of combination, where we'll be analyzing the latest clinical evidence. You see, for a long time, lactulose has been the standard, go-to, first-line treatment. But doctors started wondering, what happens if we deploy both of these weapons at the exact same time? A 1-2 punch. To find out, researchers conducted a massive systematic review and meta-analysis. If you look at this flowchart, it shows exactly how researchers whittled down the data. They applied incredibly strict criteria to nearly 2,000 records from top medical databases like PubMed. Out of all that, they ultimately isolated just 15 of the absolute highest quality clinical trials and observational studies to compare this dual therapy directly against using just lactulose alone. By pulling all that data together, this comprehensive investigation looked at an astounding 4,327 patients. I mean, we aren't talking about a small sample size here. This is hard, undeniable, large-scale evidence on how to best treat this devastating condition. And wow, the clinical efficacy comparison here is just striking. The meta-analysis revealed that combination therapy yields a relative risk score of 1.33 for clinical efficacy compared to just using lactulose. Simply put, that translates to a highly significant improvement in reversing these terrible events and upgrading the mental status of the patients. Turns out, hitting the toxin factory from 2 different angles simply works better. And let me be clear, getting this treatment right is an absolute matter of life and death. To really put this into perspective, hospitalized patients who present with hepatic encephalopathy have an incredibly grim 44% survival probability at 12 months, and it drops even further to 35% at 24 months. So the stakes for these patients literally could not be higher. Which is why the most satisfying resolution to this whole mystery is the mortality data. The pooled analysis revealed that hitting the disease simultaneously with both lactulose and rifaximin significantly reduces patient mortality, offering a relative risk of 0.71 compared to monotherapy alone. That's a huge drop in risk. By managing the gut flora more effectively, doctors are straight up saving lives that would have otherwise been lost to liver failure. Honestly, it just leaves you marveling at the incredible gut-brain axis. Think about it. The fact that a life-threatening coma caused by a failing liver can actually be reversed just by tweaking the acidity and the bacterial makeup of the intestines, that is truly profound. It really forces us to ask, what other medical mysteries, what other cognitive conditions out there can be solved by simply treating the microscopic life living in our stomachs? Keep that provocative thought in mind, and thanks for joining us on this explainer.